Once you've done your prep, you need to measure the distance between the two adjacent teeth just to get the right size OVC. If it's in the back area, often it's helpful to bend the size selector to fit in for room. Next is the replica, which is the same thickness as the hard layer of the OVC, just checking that you've got enough clearance there, and also seeing if there's any plunger cuffs that need adjusting. Placing the right matrix band, often you can place one side down and then put a wooden wedge in to stabilise it, and then you can actually place the usually the anterior area and put a wedge in there to stabilise it. I often use wooden wedges for this process, and once you've got the wooden wedges in, then you can actually, what I do is I just push the toggle against the tooth just to stabilise it, and then just screw it up nice and tight with the screwdriver. You can of course use stretch wedges, which is supplied by Rhondium, and in this case we're going to show that. We're going to have a wooden wedge in the distal, showing that wooden wedges can be used nice and easy with the OVC, and we're going to use a stretch wedge in the mesial. With the stretch wedges, usually stretch them a couple of times just to warm them up, and that aligns the polymers, makes it very strong. Then just floss it down on an angle and pull nice and tight. If the stretch wedge is riding up, you might have to do a little bit of deep box elevation first. Now we're going to make the contacts. I make one contact at a time, and what you can do is give a really good ball burnish. Then I use the edge of my flat plastic, and it actually thins the metal out in this area. It's a fantastic matrix band that can do that. Then I put my etch and bond. Whatever etch and bond system you use for your direct composites is excellent for this. Light cure. And really the secret in getting good separation with a wooden wedge is to give it a really good push again and making sure that you've got nice separation. Now I'm just going to add a little bit of flowable, and I often like to seal the lingual side as well. You can use packable if you wanted to, composite, and I push nice and firm again with my flat plastic edge, and my dental assistant light cures that. You do always, as I say, need to make sure you've got really tight wedge, pushed nice and as tight as you can get. Now I'm going to do the same in the mesial, with this time with a stretch wedge. Pull it nice and tight as you can to get good separation. The trick with separation with using wedges is to pull it really tight, and then a couple of minutes down the track pull it tight again like we've done here. And now again I put my flat plastic edge of that nice, and I push quite firm. I tell my patient there's just going to be a bit of pressure here while my dental assistant light cures that. So the flowable should go up to the contact area, not right to the top. Remove the OVC from the lid. You do that by pushing up nice and firm from underneath, and it will come out as far as it can, and then you just peel it off. Now just shape, I like to shape the soft layer into a bit of a cone and push it down into the prep. I often put a little bit of flowable first just to make sure that there's no voids in there, and you can see all the excess flowing out around the edges. That's a good sign. Now I'm going to go and tidy it up. I get my height right, like you can see there, by using the flat plastic and getting it right with the adjacent teeth's marginal ridges. Some dentists do get patients to gently bite together, but I only do that when I know I've got good clearance and no traumatic plunger cusps. What I like to do, if the patient's quite compliant, is I like to just light cure the lingual side, and that allows me to loosen on the buccal and get access in there and just tidy that up and get rid of any excess soft layer in there before I fully light cure. If I've got a difficult patient that's pushing around with the tongue and is a little bit tricky, then I wouldn't do that step. I'll just fully light cure and then do a bit more polishing at the end. Remove the wedges. I often remove the stretch wedges by cutting them and pulling them sideways. Now to loosen the band, often I can actually just fit this very fine instrument between the band and the OVC and push underneath the contact area, and in the lingual it can often make the matrix band pop away. It doesn't always do this, but it makes it a little bit easier when it does, and I cut the band on the lingual with a fine usually a red band flame burr, and then I separate the matrix band and I usually pull it buccally, and here I'm actually showing that I'm pulling it occlusally, but in the mouth I usually pull it buccally. And then I give it another light cure, of course, and then all we're doing is adjusting the bite and polishing and shaping, and then we're all done.